Hi friends, today we are going to discuss a very important topic of the antimicrobial system, that is fluoroquinolones. The fluoroquinolones are of two types, as you can see, the first generation fluoroquinolone and the second generation fluoroquinolone. The example of the first generation are norfloxacin, ciprofloxacin and oflofloxacin, and the example of the second generation are leofloxacin and gemifloxacin. So this is the way you can classify the fluoroquinolones into two generations, that is the first generation and the second generation. The mechanism of action of the fluoroquinolone is something like that. With the help of topoisomerase, in the topoisomerase 2, there is a DNA garage inhibition in the gram-negative bacteria. The nicking and formation of the negative supercoil and reselling of the strands of DNA will be blocked, and therefore by blocking this, fluoroquinolone will block the DNA replication. By blocking the DNA replication, the microorganism can't grow or can't multiply. With the help of topoisomerase 4, there is an inhibition in the gram-positive bacteria only. The nicking and the separation of the daughter DNA strand following DNA replication will be prevented, and by this prevention of the separation of the replicated DNA, the multiplication of the microorganism is prevented. By these two kinds, fluoroquinolone will act and prevent the growth and multiplication of the microorganism. The adverse drug reaction of the fluoroquinolones is, first of all, hypersensitivity reaction, skin rash, urticaria, itching, dermatitis, GI tract causing nausea, vomiting, glossitis and stomatitis. Then CNS effects cause convulsion, confusion, insomnia, hallucination, headache, dizziness and drowsiness. See, this is the particular pattern which I have been following in every video or every notes. First, hypersensitivity, second, GI tract infection, and these are the common adverse drug reaction among all the groups of the antimicrobial drugs. Then CNS effect, you can remember 2 C's, 2H and 2D, 2C, 2D and 2H. Convulsion, confusion, drowsiness, dizziness, hallucination and headache, insomnia you can add. Then the peculiar adverse drug reaction of the fluoroquinolones are cartilage damage, tendon rupture, and they are contraindicated in the pregnancy. You have to remember that they are the contraindicated in the if you remember, we have seen similar type of pattern in the cotrimoxazole also, in which hypersensitivity, GI tract are the common adverse drugs. After adverse drug reaction, let's see the therapeutic use of the fluoroquinolone. If you had watched the video of cotrimoxazole, then you will relate to the uses of the fluoroquinolone. I will recommend you to follow the sequence of the points in which I have written only, and you can refer to the cotrimoxazole video for better understanding. In the first use, that is urinary tract infection. In the urinary tract infection, cotrimoxazole is used in lower urinary tract infection, but the fluoroquinolones are used in the upper urinary tract infection and prostatitis. Respiratory tract infection, in the cotrimoxazole we have seen it is used in chronic bronchitis and acute bronchitis, but in the fluoroquinolone, respiratory tract infection include community acquired pneumonia and chronic bronchitis. Then GI tract infection, same, bacterial diarrhea. Then the three are new. First three group, first the group of 3, then the second group of 3. STDs include syphilis, chancroids, chlamydial cervicitis, urethritis, other. Then gonococcal infection and meningococcal infection. These are the group of 3. Then we have seen the nocardiosis, chancroids and typhoid fever similarly in the cotrimoxazole. Then some extra uses of the fluoroquinolone are mycobacterial infection, neutropenic patient, conjunctivitis and anthrax. These are all the therapeutic use of the fluoroquinolone. You can remember the therapeutic use in the group of 3, like urinary tract infection, respiratory tract infection and GI tract infection will always be the similar in the cotrimoxazole, fluoroquinolone, penicillin, then aminoglycosides and cephalosporin. In all those cases you will find urinary tract infection, respiratory tract infection, GI tract infection common. Then the third triad is STDs, gonococcal infection, meningococcal infection, and the third triad is the nocardiosis, chancroids, typhoid fever, and rest of them you can remember. By this way you can remember the therapeutic use and you can finally correlate all the therapeutic uses of the cotrimoxazole, fluoroquinolones, penicillin, cephalosporins, aminoglycoside, and you will find lot of similarities in them. So it will be easy for you to remember and retain it for a longer time. Thank you.